Northern Montana is using Patient Connect for all of our outreach for patient reminders and any of our campaigns, special projects that we're doing, and for staff communication with the patient's driveway. With Patient Connect, we were looking for a simple solution that is simple on the patient front to complete surveys. We rolled out with just a simple yes/no confirmation. So if a patient wasn't able to come, they don't have to try to make a phone call or we get just a no-show. So that was a pretty easy step as far as like the setup, the maintenance, and phase 2, we started with the campaigns. And so every year, all of the adolescents, they need a sports physical. We do a couple days leading into the fall where we have providers available, walk-in spots, or you can pre-plan a spot. So we send out a campaign for patients in that age range to come and advertise that we're there. You can get your sports physical, you don't have to wait. So that was a great campaign. With immunization rates, since COVID, we haven't had the best, getting people in, get their flu shots. So that's another campaign we did to try to improve our immunization rates and reach our patients that way via text. Because maybe they don't answer the phone, but they'll answer a simple text. And then with measles, we had an outbreak in our community. That's one way we were able to have a tool to reach the vulnerable population that would qualify for an advanced or an extra dose for the immunization schedule. We're trying to refocus on making sure we address those continuity of care gaps, make sure we get patients in. So this year, our behavioral health, we did a project where we're looking at our no-show rates. And so we were able to leverage our current business and clinical analytics module, BCA, out of MEDITECH, to find out what are our no-show rates, where are they worse. Our behavioral health organization had almost double the no-show rates of any other of our primary care specialty clinics. So we started a project to make sure we look at those behavioral health rates and what are we gonna do to get people in? How can you help your people if they're not coming in? So we did decide to invest in Patient Connect and get a real yes/no confirmation, but also allow our front desk to monitor, okay, who's not coming in? Maybe I need to send them an extra reminder, send them additional communication. The other thing we figure is let's leverage other existing tools we have. So we utilize our MEDITECH patient registries. We have a chronic care management program, and we have a behavioral health registry that pulls our behavioral health chronic care management patients, and we flag when's their next appointment. Does this patient have a transportation issue? Is there some coordination we need to do with the community bus or other taxi services to get the patients to come in? And so when we're looking into investing, we think back to who's our focus group, our people, and what's our purpose.